A very good evening to you and a warm welcome to our program Spotlight. And on this program, we usually talk about current affairs topics. So today we will be touching on a topic which is been widely spoken of, and that's the pandemic, and also about the number of cases being detected lately, which is on the rise. And there's also another achievement, because we have just completed 1 year since the inoculation program commenced, and we are going to talk more about the success of the inoculation drive and also what to expect in the near future and what's in store as well. So to do the honors, we do have with us Dr. Manilka Sumanatilaka. A very good evening to you, Doctor.
Good evening.
And we are proud to have Dr. Manilka Sumanatilaka with us to talk about the inoculation drive. He is the president of the Sri Lanka Diabetes Federation and also the vice president of Diabetes Association of Sri Lanka and a consultant endocrinologist of the National Hospital of Sri Lanka. And as I mentioned towards the beginning of the program that we will be talking about the inoculation drive, we have completed 1 year since the commencement of the program. So as a country, what's our progress like in comparison to the world over?
Yes, I think we have had a very strenuous and a very difficult year, but we have done extremely well, I must say, in terms of the vaccination drive. As of today, Sri Lanka has given over 35 million doses, all vaccines, to the population, and the eligible population is about 17 million, that is above 12 years. So we are almost like touching upon 80%, 80 plus. And out of this population, this is the majority, so 35 million, about 15 million have got both doses of vaccine. Another percentage has just got one dose of the vaccine, and about 5 million of the so-called fully vaccinated initially we needed a booster dose, and about 5 million of the population has received the third dose of the vaccine, which is the Pfizer vaccine, which is considered to be one of the best vaccines in the world, has got the vaccine. So I think both the health services and the armed forces have done a tremendous job over the past year. Imagine 35 million jabs. So the staff working throughout the day, sometimes overnight, 24 hour. It was a 24-hour operation some time back. So we must pay our tribute to all the staff who were involved, and for the health ministry and the armed forces and the government for supplying the vaccines and getting this vaccine drive,
successful, making it successful. And this is also an achievement when we consider it with the countries in the world over, isn't it?
Yes, certainly. That's why there may be some miscommunication here as well. Even the WHO, the World Health Organization, is discouraging countries from giving booster doses, not because of anything else. It's the disparity between the countries. There are certain countries in the world, African region and the poorer countries, they haven't achieved even 25% of the population. So I mean, we have to look at the people of the world as well. They are all human beings, but other countries are far ahead, and they have stockpiled vaccines for another generation as well. Certain, very rich countries. So we haven't done that, but we have been able to, cover our population well, and we have millions of vaccines to be given as booster doses as well, all in stock. It's a matter of getting it. So we have been very lucky, and we are ahead of most of the other developing countries in the world.
And also, Doctor, we do see a rise in the number of patients detected in the past few days. And tell us more about this and how people should behave.
Now, the virus is also evolving. This is a battle between the virus and the humans. So with the Delta, we lost the game a bit. And then with the vaccines and our lockdowns and our measures that we took as humans, all together, social distancing, all the masks, all that played a role. And the virus was partially defeated, but it's not giving up. So it's coming in another version, so Delta Omicron now. So as you know, the virus cannot replicate outside a human cell. So when the virus enters more and more humans, it gets a chance to replicate and change itself as well. That's why we get these new variants. So the Delta is going down, and at least in the Colombo area now the data says out of the 180 samples that were done, 160 were the new Omicron variant. So looks like the Omicron has taken over from Delta. So there is a good and the bad as well. The good is that compared to Delta, the data so far shows that Omicron is not that bad. I mean, the disease that it causes is not that deadly. So don't misquote, it can be deadly, not that deadly compared to the Delta variant. But the downside is it's 2-3 times more infectious than the Delta. So there's a catchy situation there. You know, with the Delta variant, about 2.5 of the infected people passed away, unfortunately. That was the number, 2.54 to be exact. With the Omicron, it may be 1% or less than 1. But with the Delta, the total infected were like 600,000 or, you know, more people. But if it is more infectious, if millions get infected, then that 1% of that large number also might be more than the number that perished due to the Delta virus. So there is even now a risk of overwhelming the health system and causing more death and destruction with this Omicron, although it's a milder variant.
Exactly. It's like it's milder, but it doesn't mean that it's safer to get infected with Omicron.
No, because you have to take all precautions. Because the numbers is the thing. It's a percentage that will get affected, as I said before, and if the numbers are huge, that little percentage also will be a large number to handle for the health services, and lots of people will, you know, passing. Even now, last few days, almost 1 person per hour, roughly about 20 odd people, you know, 18 to 24 people are perishing a day. So it's not a small number. And this is, from past experience, we have seen the April time, you know, when we reach about 1,000 cases a day and about 25-30 deaths per day, it really takes off after that in a tangent. It doesn't, you know, slowly go up. So it just takes off at a rapid rate to reach thousands. And of course, when you say 1,000 for a day, the undiagnosed people may be 3-4 times more than that.
Not everyone does the antigen or
Not
PCR.
everyone does, and they are vaccinated and they might not have symptoms as well. So and we are not going for a lockdown or closing down, so we can't do anything. Being fully vaccinated would be the only defense, I mean the best defense that we have, of course with the mask and the social distancing in mind.
Exactly. And Doctor, we did speak about the inoculation drive, and also now the booster shots are being inoculated as well. So many people are under the misconceptions of that when you get inoculated or when you get vaccinated with a booster shot, they have been diagnosed with various side effects such as blood clots and all that. So what do you have to say about this, Doctor?
Yes, so we have to go on scientific evidence. I agree, the certain vaccines, all the vaccines for that matter, what we got, all the vaccines can slightly increase your risk of blood clots. But if you get the virus, that risk is several fold more, maybe 10, 20, 30 times more than the risk with the vaccine. And as you know, these complications happen in our patients with diabetes and other cardiovascular risk factors. And they anyway, whether they get a vaccine or not, are at a higher risk of getting these blood clots. Without the COVID times, you look at the incidence of heart attacks or strokes in the community. And during the vaccination period, we didn't see a excessively high amount of those events happening. But we clearly saw that when they get the disease and when they were in hospital, those clot-related problems, heart attacks, strokes, were much, much higher than what's happening in the normal population or at other times. So that's the equation. So please don't be misled by certain false information. Just that there's a slight risk, we have to accept that, but that can be minimized by drinking plenty of water and taking your regular medications and staying healthy.
Is there
It's a
anything they should
minimal
do?
risk.
Is there anything they should do if they're a diabetes patient and they have to get their booster shots? So is there any precautions to be taken before getting the booster shot or after that if they have to follow anything?
It's just control your blood sugars, because you know, if the sugars are high, if your cholesterol is high, if your blood pressure is high, you are anyway at increased risk of getting blood clots and getting these problems. So control those factors well with your medication and with your doctor. Drink plenty of water and continue all your regular medications and you should be fine. But if you get the disease, 52% of the people, the 15,000 odd people who have perished in Sri Lanka have been diabetics, and others also had hypertension, heart problems, all that. So your risk of dying from the disease is still much higher than any problem which
Now it's encouraged, like people should get their booster shots. So what about the kids as well? Do they have to take a booster shot, or is
that I'm not the expert when it comes to deciding. The Ministry of Health will decide. So they have given clear guidelines, even 2 vaccines for a certain age above 18 is enough. Even 1 vaccine for 12 and above would be sufficient, but we'll have to follow the guidelines with the evolving evidence, and that has to be decided by nationally by the expert panels.
And doctor, what about some people are kind of hesitant to get the booster shot if they've got the double dose of a different vaccine?
The mixing and matching has been tested very well. Even the AstraZeneca, the original research done at Oxford, they have tried the Pfizer vaccine with AstraZeneca, and there is good evidence. Millions of people have been given the Sinopharm vaccine and the Pfizer. So we don't see, actually they say it's better when you mix and match, you get the best of both worlds. Certain deficiencies in one vaccine will be covered by the other vaccine, right? So I think there is no sort of contraindication to mix the vaccines at the moment with the evidence we have.
And doctor, what about kids detected with type 1 diabetes?
Yes, so that's a special category that we are looking after. They are of course at an increased risk, and we are happy even before the adults, the older kids were given, they were given preference. Irrespective of the age, they were given the vaccines. And they were given 2 vaccines, so it's up to the experts, including our pediatric colleagues, to decide when we need a booster dose for them, because they are a special category with an increased risk, but they were given the vaccines pretty early.
Right, so which means that anybody who has been detected with type 1 diabetes, they could approach and
yes,
they can
of
request
course,
for it.
even before the above 20s were given, they were given the preference. And was at the Lady Ridgeway Hospital, and in our clinics they were given priority and given the vaccine some time back, and they have all been, most of them have been covered.
And doctor, what about the post-COVID diabetes situation?
Yes, that is a evolving entity again. As you know, there were thousands of people, hundreds of thousands of people who were infected with COVID, and we see different syndromes. Chest problems, aches and pains, psychological problems. Now, increasingly, we are seeing newly diagnosed diabetics among even the very young people, those who have got COVID few months back. When I looked at the literature in the world, other countries, they also have realized this trend. We know with COVID also, the sugar levels go up very rapidly. The virus tends to affect the beta cells, which is secreting the insulin, and there are a lot of mechanisms postulated why it causes. So it's that happens, but then it goes down again. It tends to come back over and above the normal occurrence of diabetes in the population. So we are seeing an increased trend.
Increasing patients as well, new patients.
New
you mean.
patients who
Right.
didn't have any risk factors or family history or anything, but just had COVID a few months back. So
Right.
we need to study this more, but I would say it's safe. Anybody who has had COVID to check your blood sugars in 6 months and in 1 year, or if you tend to have any symptoms suggestive of high blood sugar, like increased thirst, unintentional weight loss, and any numbness or blurring of vision, that sort of symptoms, better to get your sugars checked. It's a simple blood test of a fasting blood sugar.
Exactly, doctor. So now, since we spoke about Omicron and that people say it's milder, so they can cope with it or something like that. But this is also quite a risk, isn't it? Post COVID diabetes.
Yes, that is one thing. But again, I must reiterate that the mild thing should not be taken very lightly, because the more the numbers are, the complications also will come. I know it's a lower percentage, but if you are the unlucky one, still people can die of the Omicron, which we see now. And the hospital beds are slowly getting filled up. So that means people are getting the complications, they can't manage at home, and they are coming to hospitals. The intensive care beds are also getting slowly filled up. It's not capacity still, but there's a risk of again reaching like the way with the Delta variant. So don't take it lightly. You should take all precautions like before, I think even more, in terms of social distancing and adhering to the health guidelines while going on with our day-to-day life without any restrictions, I think, which is good after so long. And of course, please get your booster dose, or if you are not vaccinated, please get a start on it, because the next 2 to 3 weeks will be vital. It's starting to take off, and even if you take your booster dose tomorrow, it will take about 2 weeks for you to get the full immunity, or more to say, protect yourself and brace for the next Omicron onslaught from the virus, right? So please be ready, get your booster doses.
Exactly. And doctor, when someone's detected with COVID, when they're positive, how long should they remain indoors? Is it 14 days?
No, the recommendations have changed. In a fully vaccinated person, you should get the details and publish. I think it was on the news as well. A fully vaccinated person with no symptoms, with exposure, you don't have to do anything. There is no isolation now. That's the difference. So you have to get on with it. So if you are fully vaccinated, means with the booster dose, and if you are exposed to a COVID positive person, unless you have symptoms, you have to go to your with your daily routine. You have to go to work and get on with it. So the people who are not vaccinated or not having full cover will have a problem, because those people are also potential carriers, and they can infect them. So if you are not vaccinated and exposed, then of course you have to be 7 days or then 10 days. If you have symptoms, 10 days. Those guidelines are there, which were renewed recently, but they are much relaxed than the compared to last year.
Because we need to get on with our day-to-day activities as well.
Activities.
And also about the booster. Many people talk about how now we took 2 doses of it, and then it's a 3rd one. And there are certain countries offering the 4th booster as well right now.
Yes.
So will we have to follow that trend as well?
We are always following. So it's Israel, the pioneers in all the research and this thing. They are trying out the 4th dose. So we don't recommend anything without good data. We are lucky that other countries are doing the research and trying these things out, and we look at the safety data and recommend should the need come. But we, as we said, it's just 1 year since down the line, so we don't have to think about a 4th dose at the moment. But who knows, after the 3rd dose, for how long the immunity will last, we will be monitoring the antibody levels, and those studies will show when the levels will go down after the 3rd dose. If that happens, then we'll have to think about a 4th, but not at the moment. We are not talking about it at all.
And doctor, I also came across an article online regarding introducing pills for COVID.
Yes, of course, there are many compounds are in research, and an Australian group, I think, had a successful what you call a phase 3 trial, which showed reduction in the virus load at if you take it early, like the Tamiflu tablet for the influenza. I mean, what we have, antiviral is in the horizon. The cost may be a factor, but very soon, hopefully, we'll be getting this. So that's why we don't have to think about a fourth dose. Just get the third and protect yourself, so that there'll be other medicines to tackle the problem, and this might become like a normal, common cold. Hopefully, in a couple of years.
Hopefully, because I think it's still trending. I mean, we are still getting updated about
yes,
the progress.
Things are evolving, and even the doctors are learning on the job, I must admit. Nobody can predict what will happen in another year. So it's the evidence is evolving, research is going on, and then we are taking the best educated, according to the evidence, the best decisions are taken by the experts for the country.
And the safest decision.
Safest option that we have.
Exactly.
May not be the ideal option that we have, but under the circumstances, this is the best that we can do.
And Doctor, we've come towards the latter part of the program as well. Your message to the public on the booster shot?
I think we have said this
enough.
A lot. Especially for the diabetics, please control your blood sugar well, control your blood pressure well, and the cholesterol and the risk factors, which will minimize the side effects of the booster doses if you have a concern. Hydrate yourself well, drink plenty of water, 1.5 to 2 liters, minimum 8 glasses a day, which will reduce the risk of all these risk factors, and take your booster dose. That will protect you from the Omicron variant should it takes off like the Delta variant before.
Thank you very much, Doctor, for enlightening us on the importance of getting the booster shot and about the post-COVID situation as well for diabetes. Thank you so much for being a part of the program Spotlight.
Thank you for inviting.
With that, we conclude this week's edition of Spotlight with Dr. Manilka Sumanatilaka, Consultant Endocrinologist, National Hospital of Sri Lanka, and is also the President of Sri Lanka Diabetes Federation and Vice President, Diabetes Association of Sri Lanka. With that, we conclude Spotlight. Have yourself a pleasant night.
To be caused by the vaccine or the booster dose.
And